Hello, everybody, and thank you for joining us. My name is Lisa Onaga, and on behalf of my co-organizers, Stephanie Hood, and myself, we'd like to welcome you to the first event of this academic year's Institute's Colloquium at the Max-Planck-Institut for the History of Science. The theme of this series is called Crisis and Capacity, Perspectives in the Humanities and Social Sciences. And before I go on to telling you a little bit more about what this year's colloquium is going to look like, and specifically what today's workshop, or rather roundtable, will be looking like, I'd like to hand the microphone over to Jürgen Wren, one of our Institute directors, for some words of welcome.
So thank you very much. It's my pleasure, really, to see you all, and to thank you, Lisa and Stephanie, for organizing this event. And it's, of course, a disadvantage that we cannot meet physically, but it is a great advantage that we have people here from different locations, also from different time zones. So I consider that a privilege, and I welcome you all to this event. This event, as far as I can see, it's under the title COVID-19 in the Rearview Mirror, Pandemics and Historical Perspective. And as Lisa will surely tell you in more detail about the format, it's a roundtable format. Panelists will reflect on their research and practices since the pandemic, and they will discuss what has changed since their respective history of science on-call videos were produced. Today's roundtable participants are Harry Wu from Hong Kong University. Welcome, Harry.
Hi.
Bonhomme from our own Max-Planck-Institut for the History of Science. Hello, Edna. Anna Elsner from the University of Zurich. And I hope you all had a chance of watching their great video performances. Before I hand over to the moderator of today's event, Lisa, let me say a few words inspired by the title of this series. When the title of a history event speaks about a rearview mirror, who would not think about Walter Benjamin's famous angel of history, who looks backward towards the past? Admittedly, he does not talk about rearview mirror explicitly, but how could the angel of history, while facing the past, not have also used a rearview mirror to take at least a glance at the future? That is, in any case, what I think historians should do. But let me first quote from Walter Benjamin's essay on the concept of history. There is a painting by Paul Klee called Angelus Novus, which you see here in my bag with appropriate modifications. An angel is depicted here, is depicted there, who looks as though he were about to distance himself from something which he is staring at. His eyes are opened wide, his mouth stands open, and his wings are outstretched. The angel of history must look just so. His face is turned towards the past, where we see the appearance of a chain of events. He sees one single catastrophe, which unceasingly piles up rubble on top of rubble and hurls it before his feet. He would like to pause for a moment so fair, to awaken the dead and to piece together what has been smashed. But a storm is blowing from paradise. It has caught itself up in his wings and is so strong that the angel can no longer close them. The storm drives him irresistibly into the future, to which his back is turned, while the rubble heap before him rose sky high. That which we call progress is this storm. End of quotation. Benjamin reminds us, in particular, not to forget the victims of the catastrophes of the past. A reminder quite appropriate in the times of the COVID crisis, which has produced so many victims all over the world, and which is a crisis that we can only see in a rearview mirror if we face, like the angel of history, the past. Since this past, to quote William Faulkner, is surely not dead. It is not even past. For the role of history, Benjamin calls upon Marx and Nietzsche, quoting the latter with his famous aperçu, which may serve as the motto for the entire series based on the initiative History of Science Encore. I quote, "We need history, but we need it differently from the spoiled lazy bones in the garden of knowledge." End of quote. I am looking forward to the panel discussion, and I assure you we will have ample time for discussion afterwards. Thank you very much.
Thank you very much, Jürgen, for such a beautiful introduction and setting the tone for us to think with as we proceed with the rest of the academic year. This particular roundtable format is a bit different from previous sessions where we've had single speakers, and we thought we'd do this to create some more dialogue, a roundtable that is designed to create solidarity in this time of crisis. And the word crisis here in the title, of course, refers to the immediacy of needing to understand what is the disease, how to deal with it in those harrowing days of the pandemic in the early bit of this year. And then in the springtime, decisions about lockdown, and now various adjustments to the quote unquote new normal. But there's so much more that adds and outlines the crisis as opposed to these very clear time markers of how things have proceeded. And the word capacity in our title refers to the ability and the responsibility and the decisions to recognize and respond or not respond to specific aspects. And those could be at the individual level or at institutional levels, all while reckoning with new sources of stress or suffering owing to the particulars of the crisis. So scholars in the humanities and social sciences, and of course historians of science writ large, from history of science, medicine, technology and environment, et cetera, have been filling that capacity in public discourse, and crucially so in ways that differ from and complement the sciences. Our Colloquium series is trying to highlight colleagues whose research has made it, in fact, difficult, if not impossible, for themselves to turn away from those roles, from dealing with that capacity issue. And at the same time, we are striving to do our part to notice and amplify these scholars. And this has been done in part here at the Institute by the Humanities Solidarity Video Project, which Jürgen mentioned, the Young Hall Project. This is something that Stephanie and I organized with Dagmar Schäfer. And today's event expands on that missive. And so we've invited 3 alumni from that project. And we're really interested to hear from them how the pandemic has reformulated their research questions and what that means for humanities and conducting research and writing. And even though ourselves we're not historians of plague or virology, what have you, we're sure that there's something here that will strike some resonance fundamentally with this issue or question of what does it mean to do humanities research now while looking back at where we've been. So next I'm going to tell you a little bit about the format. I'm going to introduce each of the speakers before they speak, and then they will ask questions of one another and discuss a little bit, and then we'll open it up for 30 minutes at the end for Q&A. And we're really looking forward to expanding this discussion to engage ourselves with the panelists' thoughts and their contributions through that Q&A. Here is some additional information about just housekeeping rules. We are recording the roundtable, so if you could please turn off your mics. If it is not your turn to speak, you can just hit the mute button and unmute it when it's your turn. And if you'd like to ask questions, please put your name on the queue in the Etherpad, and I believe the link to the Etherpad should be there. If it's not there, we will put it in there during the talk, so you can get to click on that and have it open. And there's also a space for writing out your questions on the Etherpad if you'd like to contribute a question that way. And again, that is relevant for those who do not wish to be recorded. If you would not like to be recorded, please just turn your camera off, and you can write your question there. And Stephanie will be co-moderating those questions and will read those questions on your behalf. So I am going to, as soon as I finish this, I will start to figure out how to end my screen sharing. I think I can do this, but if I can't, does this work, everybody? Okay, so I'd like to first introduce Harry Wu, who joins us from the middle of the evening in Hong Kong. He's a historian of medicine and director of medical ethics and humanities in the Faculty of Medicine at the Li Ka-shing Faculty of Medicine at the University of Hong Kong. And he was originally trained as a physician in Taiwan and worked in psychiatry before moving to the University of Oxford, where he earned his degree in modern history, and specifically from the Wellcome Unit for the history of medicine. And Dr. Wu also taught at the Li Kongqian School of Medicine in the history program at Nanyang Technological University in Singapore. And his research, I think, is quite relevant to what we're talking about today. He's been looking at histories of agenda setting in mental health and now in hazard exposure and end-of-life care. And his new book, which is coming out with MIT Press next year, has been looking at the formation of the WHO and the common language of psychiatry that formed through work with medical officers from Taiwan. Interestingly, Taiwan is not recognized by the WHO informally. And so, but nonetheless important for creating a universalizing vision of a world psyche. And so his perspective will be quite interesting given the role not only of the WHO for declaring the global pandemic and also these political relationships, but for the clear relevance of mental health for understanding the pandemic. So Harry, the floor is yours for about the next 12 minutes or so.
Okay, thank you, Lisa, for inviting me to this exciting panel. And I feel quite surreal that, like, since last time that we had a opportunity to really reflect on several questions some months ago, and then we are still in the pandemic. And as a historian, this is really a surreal moment. And so, yeah, so first of all, I really cannot imagine that I had to, since the pandemic, that I had to respond to so many requests from journalists, as if history now is very, very important. Well, it has been put onto the front line to answer a lot of questions scientists cannot really do, right? So, well, this is for me, this is the experience is quite overwhelming, right? And I never realized that I had to write so many things about infectious diseases, because my discipline is actually history of psychiatry and other non-infectious diseases. And suddenly people want me to speak. And then I also feel a little bit awkward, but then I gradually know what the reasons are, right? And there's another reflection I feel, I keep that feeling that this moment is so relevant to the period that I study, especially like the period I study in my book, the immediate post-war time, where nationalism and internationalism, they develop hand in hand, actually. Well, today a colleague actually joked to me that people are concerned whether or not the world is now entering the world that is described by George Orwell, the 1984, the kind of the Orwellian style of dictatorship. But actually, perhaps we are entering the novel that was written earlier by Aldous Huxley, A Brave New World, right? People are actually engineered into well, in the novel, people are engineered into a kind of intelligence-based social hierarchy. But now that social hierarchy is defined by immunity. Right? So, well, it's quite interesting to look at, for example, like in the period I study in 1950s and 60s. Right, there was a very, very serious flu from Hong Kong, right? Hong Kong flu in 1957, right? And then, well, there was even a song, right? There was a band called the Ethiopians, right? And if you are interested in this, just Google it or just type it up in YouTube, and you can listen to that reggae style of song called Hong Kong Flu. And at that time, it was, well, Asia was just a generalized threat during the Cold War, right? And if we really look at, there's also quite an interesting YouTube footage that is now, well, it was in 1957 produced by Westinghouse broadcast company. It's called Silent Invader. So at that time, that flu, Asian flu, is very racialized notion. But actually, it was quite in people's experience, I think this is very, very normal, very mundane kind of description, right? But now, in 2020, we see a comeback of the historical scenario that actually really resembled the anxiety in the intermediate post-war period. So let's go back to the very beginning of the pandemic. The fact that the outbreak occurred in Wuhan, right, the Chinese city Wuhan, made people assume a lot of things. That it was, for example, there was a conspiracy theory that the virus was produced in a lab, and it was caused by the ill management and maybe poor leadership of Wuhan city, and it was the autocrat system of China that should take the full responsibility, etc., right? And now we immediately saw that there is an effort to really neutralize the name of Wuhan. But actually, the naming of COVID-19, of course, does not mean that this disease is neutral. It was also very subtle political manipulation to prevent this kind of a nationalism that is already growing for the past few years, and also the aggression that come along with it to loom large. So the fact is that we can't really turn our head from this, that the fact that COVID-19 means to different stakeholders rhetorically and also perceivably. So in the case of China, we see a lot of stakeholders. They're trying to construct a picture of COVID-19. The state has its own political mission, right? But also on the ground, we also see more and more literary works emerging in the form of diaries. And there are also numerous efforts trying to preserve, for example, like screenshots, right, deleted or censored by the state. So this is some area that is very, very worth exploring, related to how technology has an impact on history making, right? So going back to those questions I reflected in my Science on Call, perhaps I just answer one of them, re-answer one of them, that I talked about the limitation of science. So in that previous video, I talked about the drawback of epidemiological prediction. And after several months, we did find that numbers or figures, these statistical figures, have become less and less precise, and they remain conceptual. But of course, I developed new reflections because now people are shifting their attention from statistical numbers to other, for example, like non-pharmaceutical interventions in different parts of the world. So when we talk about science, and we are mostly concerned about whether health policies are really led by science. And then we realize, of course not. Right? In the US, for example, like Anthony Fauci, he was sacked by Donald Trump from the CDC. And back in Hong Kong, physicians and other health workers, they had to wage a strike, 5 consecutive days of strike to urge the government to take more stringent measures of public health control. But the real problem is not really about whether or not the policy is led by science. It's actually about the society. It's about the trust and distrust and how we understand the society enough in order for science to function well or at least have an impact. So I think as historians now, my reflections is that we really need to proactively assess the relationships among the public and science as advisors perhaps, or they can be activists and the government. And we have to zoom out because we don't only live under one government. We also have World Health Organization and many other forms of governing bodies. And we now exist as a whole in an international community. And so another aspect of science that becomes more and more important was vaccine. So if we look at 1957, the TV broadcast was the only source that people watched, and then people believed what is said on the TV by experts, right? But now the world is becoming more and more complex, and then the way people communicate is really different. Now we live in a world of social media, and people don't actually tend to believe what they see, what they read. And so this is actually a in a post-truth society, post-truth context. And now it is becoming very difficult for us to really know what truth really is. And now, of course, we know that vaccine production is slow, right? It's not as simple as what was described maybe 50 years ago when we were facing the Asian flu. Right? And we have a lot of other kinds of measures in addition to vaccine, because we're still waiting for it. We now have a lot of non-pharmaceutical interventions, MPIs, right, for prevention. Now for treatment, we have a lot of drugs still on trial. We have antibody sera, etc. And facing these things that are still unknown, my reflection is that we need to grow more humility, and we need to become more mindful of what history teaches us. Is that no matter how prepared we are, there is always something that is unexpected that might occur. And previously, for the past half century, this kind of magic bullet kind of approach, technical approach, is always tempting. When there is some new technology, we are all tempted, we are all allured to really want to try it. But actually, most of the time, they were proved ineffective. I think I've got 2 more minutes, and then I am trying to reflect on something more local, right? So in my video, I also reflect on what messages does COVID-19 convey to health sciences students regarding the history of medicine. Right? Now the scenario is Hong Kong. And in Hong Kong, over time, medical discoveries actually shaped the identity of medical professions in Hong Kong. That momentary event was the bubonic plague, broke out in 1894. And there was a fascinating story about the competition between Alexander Yeltsin and Kitasato Shibasaburo. And we still can smell that kind of thing in Hong Kong. Right? For example, like months ago, Hong Kong U published something. We are the first one to identify coronavirus that can reinfect the same person. CUHK, Chinese University of Hong Kong, said, we found that the virus is found in the stool of those who have recovered from virus infection. But for me, what is lacking really is not, we have a lot of competition already. We have a lot of information we want to really take pride on. But what is really lacking is how science can really engage with the public and at the same time actively advise the authority. So some rigorous approach to assess the societal structure and people in the structure and how science functions in the complex system is very important. So not only in general in the world, but also at a local level. I'll stop here and then I'll leave some other reflections to the time of Q&A.
Thank you so much, Harry. It's really wonderful to hear these points that dovetail and complement your on-call video so nicely. Next, I'd like to introduce our second speaker. Edna Bonhomme is a Haitian-American scholar, art worker, and writer, and many of you know her since she is here at the Max-Planck-Institut for History of Science, where she is a postdoctoral fellow investigating the global archaeology of race, health, and post-colonial science. Dr. Bonhomme holds a PhD in history of science from Princeton University, as well as a master's in public health from Columbia University. And together, these experiences inform a basic question that she holds throughout all of her work, which is what makes people sick? This is a very simple question, but one that generates so much inquiry. And she uses a historical materialist approach to build upon earlier work on plagued bodies and spaces in North Africa using the lens of trade, looking at the convergence of sanitary imperialism and traditional medicine from the 19th and 20th centuries. Her current project, Biometrics of Care, looks at toxicity, contagion, and health outcomes of African diasporic people in Europe and the Americas. And if you've looked at her video, you then know also that an underlying theme in Dr. Bonhomme's work is empathy and creating capacities. And to that end, she has collaborated and exhibited critical multimedia projects in places from Berlin and Copenhagen to Prague and Vienna. Those have explored the genealogical mutations of archives and memory. And I also need to mention that she is a prolific writer, and some of the pieces that she's written include COVID-19 denialism and xenophobia in Spectre Journal, Embracing Intersectionality in the Age of Bad Data, that was in Environmental History Now in July 2020, Ill Will, appearing in the Baffler magazine in April, and What Coronavirus Has Taught Us About Inequality, appearing in Al Jazeera, and her other writings appear in Missy magazine, Nation magazine, and Africa is a Country. And she continues with this empathy and capacity building through her teaching at Humboldt University, Bard College Berlin, Drexel University. And this fall, she'll be teaching a course called Fear of a Pandemic at Freie Universität. So welcome, Edna.
So first of all, thank you so much to everyone, Lisa, Stephanie, Verana, for technical work, as well as those who have a double burden of care work right now. I'm also grateful to the co-panelists, Harry and Anna, whose work cuts across the intersections of public health and care. And it's really important to be talking about this topic of the pandemic and COVID in this moment, mostly because, like Harry, I have this sentiment of thinking about history and oscillating between the present and the past, especially with the overwhelming health inequalities that are present, as well as the social inequalities that make the burden of disease unequal. And I'm sure most of you have been reading about or have read about the resurgence of the global Black Lives Matter movement, in addition to the ways in which in whether it's the UK, where they have this data, as well as the US, that there's a disproportionate amount of Black and minority ethnics or people of color who have not only been tested, have higher rates of COVID-19 infections, but also deaths. And as the US right now is nearing 200,000 deaths from COVID-19, which is more than 1/5 of the deaths globally, it's important to hone in on some of the social dynamic that relate to these health inequalities. And I think that in looking at those health inequalities and the precarity of life and death, it gives us a moment to point to previous issues around health epidemics, but it also allows us the space to think about what types of issues that today that can allow us to look at the intersections of race and health. And for me, in this moment, there are three axes that I've been reflecting on for within the history of science context. One is the question around race and reproductive health, the other around childhood, and the third being around incarceration, which I'll reflect on for the upcoming December ISIS pandemic reflection. On the first issue of reproductive health and COVID, especially as it pertains to Black Americans, one thing to note is that there are various challenges to reproductive health that scholars such as Dorothy Roberts has written about in Killing the Black Body, to the history of Black women and reproductive capacities that have reshuffled themselves in the moment of COVID, especially given that the novel coronavirus is presenting some pressing questions about Black reproductive health. And so one study recently found that 44% of Black people are shifting their fertility preference towards abandoning the idea of pregnancy compared to 34% of the general population in the United States. And that has a lot to do with the financial insecurities people are facing, as well as loss of work and other issues. But beyond that, the American College of Obstetricians recently published a report that Black and Latinx pregnant patients are more likely to test positive for COVID-19 than their white counterparts. So this very new data actually that is showing those inequalities points to an even more grave issue around reproductive health, is that Black women are 3 to 4 times likely to die than white women from pregnancy-related deaths in the US, which preceded COVID, but now as we are starting to see what's happening is exacerbating it. So this preliminary data in many ways is just that, but it also speaks to the ongoing and growing research that is so important about reproductive health, race, and disease, which Deidre Cooper Owens in Medical Bondage has written extensively about. And it also shows us like what works and how do we do better work in history of science to look at the intersections of race and inequality. The second point that I think and is important to note, and this has recently come out, is the question around children in the United States and how they are at this moment very susceptible, growing susceptibility based off of the racial identity. So with the COVID-19 pandemic hitting different groups, children and teens are suddenly testing positive, and there were more than 390,000 cases in which 121 deaths happened to people under the age of 21. And of those 121 deaths, about 78% were children and teens of color. So that's to say 45% were Hispanic, Latinx, and 29% Black, and 4% Indigenous. And this is quite unfortunate because what it shows is that systematic racism and inequality in health is killing children in the United States. And what it also shows is that at the end of the day, the people who are more likely to be essential workers, who can't work from home, who have higher exposures and risks, are also living and in some cases transmitting to their children. And those disparities in the social determinants of health have very wide-ranging impacts for those youth, as well as for the schools that they go to, the communities they live in, etc. Another area that I think that I've been reflecting on extensively, and this perhaps because of the ways in which incarceration and abolition has become absolutely central to the Black Lives Matter movement, is incarceration. And since April, about 78% of the inmates in the state prison in Ohio have tested positive for the novel coronavirus. And in California, in one of the prisons, in Lompoc, California, 70% were tested positive. And although thousands of kilometers apart, these confirmed cases of prisoners, and mostly Black prisoners, reveal the increasing death. And it's not an aberration that the prison industrial complex has created an incubator for the disease to spread. But it's something that happened during for example, tuberculosis outbreak, HIV outbreak in New York City in Rikers prison, as well as in other prisons in the 1980s. So prisons have become a place in which pandemics and epidemics have bred. And the novel coronavirus, similar to tuberculosis in the 80s in New York City prisons, spreads through the air. And so for so many people awaiting the end of their sentence, poorly ventilated cells have, in some cases, become the source of contagion. And this matters significantly because about 1.5 million people in the United States are incarcerated, and this forced confinement does not has a negative impact, not just on the incarcerated, but also on the workers and the workers who have family members, et cetera. And these people are particularly made vulnerable to contagion. And during this current moment, especially during the summer, the ACLU has called for the most vulnerable populations to be released. Various activists have called for abolition or prison abolition, to say that people should transition away from these facilities. And part of what the coronavirus is teaching us in this moment is how the outbreak and how these medical questions can open up broader political questions about social justice, about prisoners' rights, and also about the history of enslavement and forced confinement. So it kind of begs the question also, who gets to move under these conditions? How are borders constructed, and how are people thinking about these spaces in a post-colonial context? One entry point that I've been thinking about deeply to not just position history of science and the present is to think about the philosopher's work, Sheila Memembe's Necropolitics, and how he, in Necropolitics, unveils the fault lines of society and the hierarchies of human. And in many ways, he looks at the plantation society as one of the earlier sites of experimentation, which then becomes a kind of place in which punishment and confinement impacts people's bodily experience. Another work that I've been reading and thinking about very deeply as I try to see how can history of science relate to other subjects is Ruth Gilmore's Golden Gulag, where she focuses on California but sees how the rise of capitalistic technologies impacts not only the geographies of the carceral state or incarceration, but also the health and the bodies and the spirits of people. So in thinking about COVID-19 and the pandemic, especially as I start to interview and have been interviewing people who are identify as Black here in Germany as well as in North America, is what does this pandemic mean to them? Do they have incarcerated people and their loved ones? To what extent do people know someone who's died from it? What are the resources that are available to people? And part of why doing those interviews in this moment is so important is that it allows me to unpack the unevenness of how particularly Black people in the global North are impacted by the disease, but it also gives way to create a new set of archives in somewhat of the journalistic manner, but also one where people are able to tell their own stories, their own accounts of what is going on. And so in many ways, this interrogation of both looking to the past, looking towards philosophers like Memembe, as well as just the people most directly affected, it shows how history of science can be relevant to the present while also reflecting on the gravities of the past. And I guess I will end too, which is with one thing, which is that in all of the people that I've been interviewing recently, everyone still has this capacity for hope and joy. And it's been so beautiful to just ask people what they're reading, what makes them smile, like people who in their confined state or in lockdown are able to spend more time with their children, and they love that. And I think that despite the crisis or some of the crisis that's happening, there's also the capacity to move beyond trauma, to move beyond crisis, and to really excavate this capacity for life and joy. So I'll end there. Thank you.
Thank you so much, Edna, for this hopeful note to pass the baton on to our next speaker. I know I'm really excited for the discussions already. But we have one more person. This is Dr. Anna Magdalena Elsner, and she is a Swiss National Science Foundation Marie Heim-Vogtlin Research Fellow at the University of Zurich, and is affiliated with the Institute of Romance Studies and the Institute of Biomedical Ethics and History of Medicine, and an associate member of the Center for Humanities and Health at King's College, London. Dr. Elsner holds a PhD in French literature and philosophy from Cambridge University, and was a Leverhulme Early Career Fellow in the French department at King's College London, and was also the Joanna Randall McIver Junior Research Fellow at St. Hugh's College in Oxford. And at the moment, she's completing a project on palliative care and how that's shaped autobiographical writing, documentary film, photography in France since 1975. And this is the basis for a monograph that she's currently in progress on. In a nutshell, it's about palliative care and how it's reshaped dying in France. And Dr. Elsner is co-organizing 2 conferences on COVID-19 at the moment, which some of you may be interested in. So I'll just describe them a bit. It's about COVID-19 and the humanities, and one is on ethics of care, and that's held at the Brocher Foundation in Geneva this November. And next July, there is going to be an event called Borders and the Medical Humanities. This will be at the University at Vienna, along with the Austrian Academy of Sciences. And I will put a link later to the call for papers for the second one. So in contrast to these discussions about COVID cures and the anxieties about understanding and preventing disease and so forth, Anna's work contemplates how this pandemic has forced open a rupture, so to speak, a disturbance to the taboos that have previously existed about death. And so now people are talking more about death. What is a good death? How do we define that? And that's something that we've invited Anna to reflect about for this roundtable. So take it away, Anna, and welcome.
Thank you so much, Lisa. This is really a wonderful opportunity to go back to the videos that we made earlier this year. But unlike the videos which we made all by ourselves in our confinements, it's really nice to be able to, now connect with each other and really connect with each other's ideas in this format. So this is a wonderful opportunity. Thank you to everyone who co-organized this. So what I want to do is sort of come back to 3 points that I raised in my video, and that is, first of all, say a bit about palliative end-of-life care and dying during the pandemic and how discourses around that have changed, and then say something about the literary and visual receptions of COVID-19. And then finally, think about humanities research and teaching in and beyond COVID, which is something that both Harry and Edna also touched upon. So in March and April, and against the events in Italy and elsewhere, end-of-life care in connection with COVID-19 was predominantly addressed through a public health ethics lens. So in the foreground, there were questions of rationing and triage. And given the situation at the time, that wasn't surprising. But what was less present in these early discussions was palliative care. And I think it can be said that this has very much changed since, and there's been a lot of discussion of pandemic palliative care and considerations of end-of-life care beyond ventilators and saving lives. And I think this discussion has also gained further traction through reports of loneliness and depression as a result of lockdown, but also within hospitals and nursing homes, and questions whether the restrictions of visitors to these institutions did ultimately maybe not do more harm than good. And I think this question also by its very nature is a question that goes to the heart of the philosophy of palliative care, because it's ultimately a question of the quality of life and the quality of death that we want to provide in our social systems and healthcare systems. And so it seems to me that the field of palliative care has indeed entered a certain period of reckoning. And Haider Varaj, a cardiologist at Harvard, and who published a book in 2017 entitled Modern Death: How Medicine Changed the End of Life, has recently claimed quite interestingly that palliative care has an image problem. And he made the case that palliative care has become even more scary during the pandemic than it was before. And I think this was, for me, a rather surprising turn in the discussion around end-of-life care during the pandemic. So why did I find this surprising, and what exactly did Varaj mean by that? I think he sort of tried to reignite a discussion that has a long history in palliative care, namely how to call this subspecialty. When Cicely Saunders, the founder and pioneer of palliative care, first came up with her ideas, she spoke of hospice, and it was then through the Canadian physician Balfour Mount who coined the term palliative care, because he thought that in a French context that would be more easily adapted. And the interesting thing is that this discussion has really lived on since, and also since palliative care was sort of defined by the World Health Organization. And what has dominated the discussion in the last decade is the fact whether it should change its name, because it's no longer, or the specialty no longer sees itself as merely targeting terminal patients, but offering support care beyond a terminal diagnosis. And I find it's extremely interesting that this discussion has re-emerged as part of the pandemic, and again with sort of the emphasis that patients are scared of palliative care because it suggests death and dying. And this seems completely opposed to what Saunders really had in mind when she started her work at St. Christopher's Hospice in London, because then the idea was really that medicine needs to find a better way of dealing with dying, integrating dying into its practice, but also into its language. And I didn't quite expect, even so that was perhaps to be expected, if you read someone like the philosopher and historian Harari, that the pandemic would do quite the opposite of changing our attitude towards death. Namely that, amid this pandemic, which brought us closer to discussions of mortality, this question arose again, whether the subspecialty should change its name. And I don't want to generalize here, because as I've said, it's a discussion that predates the pandemic, and it's certainly not the only discussion around palliative care. And yet I think it does show the more fundamental problem, and that's also what I tried to mention in the video, that this sort of marginalization of mourning practice, the erosion of death and dying from public life and medicine, is thereby again taken up and pushed further. Now, this brings me to the second point, namely, the role of my work with regard to literature and visual culture and COVID-19. So when I made the video, what was at the forefront of my attention then were written responses, testimonies, literary accounts, also what Harry mentioned, diary entries about experiences of lockdown, of quarantine, of COVID, of long COVID, but also public responses by, for example, the French writer Arnaud, who wrote an open letter to President Macron about his healthcare politics, or quite well-known writers, Leila Slimani and Marie Dariussec, who described their rather sort of privileged lockdown experiences. And I'm still of the opinion that this work and what is still to come, and there is surely more to come, will form the basis for literary scholarship that will allow us to access these different conceptions of health, of illness, of care, of empathy, of lockdown measures, and how they were experienced during the pandemic. But what I'm working on at the moment, and my perspective has changed a bit in that regard, is quite literally what Waraj calls this image problem of end-of-life care and palliative care, namely sort of the visual representations of end-of-life care in France and the visual codes used to write about palliative care, for example, in French media. And in France and other countries, the sort of stock photo to encapsulate palliative care is very often the image of the two intertwined hands, often an older hand that is held and guided by a younger, caring hand. And it was and is quite fascinating to see to what extent this image dominates discourses around palliative care, even around palliative care during the pandemic, even if precisely this sort of proximity and touch that the public imagery connects to palliative care, where precisely sort of this proximity was no longer and is no longer possible due to social distancing measures and restrictions of visitors to hospitals and retirement homes. So what some of the work that I'm involved in at the moment seeks to do is to move beyond the visual code of the two intertwined hands, showing a more problematic, a more difficult, a more complex view of how end-of-life care is experienced. And this work relies on a number of photographers in France that have documented end-of-life care before the pandemic, and who continue to do so as during different outbreaks in nursing homes that were particularly publicized in France. And this brings me to my final point about the role of humanities research and teaching in and after COVID-19. In his video, Harry talked about teaching humanity courses as part of medical curriculum and the difficulty of not offering a linear perspective on history in these courses, because very often one is assigned a limited amount of time. This is an experience that I share very much. But my hope would really be that the current moment may motivate us to rethink and push further cross-disciplinary approaches by, for example, allowing history and literature and film to work closer together. And, you know, this undeniably, this has already been done, and it's a process that has, you know, in the medical humanities already has its own history, and it remains a continuous challenge. But I think it also is really a potent recipe against the sort of linearity, against the one story, and toward a sort of multidimensional experience of health and disease. And I believe that this is a crucial way to address what I've called this sort of larger underlying crisis of care that I see as playing out in so many different ways and forms during this crisis. And in a way, Edna's video for me already spoke to this more invested cross-disciplinary approach, because you, Edna, you explicitly mentioned speculative fiction, the work Octavia Butler that the current moment evokes for you, but also the need for testimonies of on-the-ground workers. And this really got me thinking because, of course, given my the angle of my work and what I'm interested in, questions of literature as testimony, the problems of authenticity and autobiographical writing, they're very much at the heart of my approach and part of the theoretical apparatus I rely on in order to analyze these accounts of dying that will come out of this crisis. But of course, a huge problem for me is the very privileged nature of many of the accounts that I'm dealing with. I mentioned a couple of the writers and thinkers in France who've published on COVID-19, and the majority of these are well-known and well-established. And France Culture, the French radio station, ran an interesting program with testimonies of on-the-ground workers, but this is, of course, a very punctual phenomenon, and these voices are unlikely to become bestsellers or even be published. So I think this is certainly an opportunity for literary studies and history and anthropology to work a lot closer together, because I think literature can bring some of the analytical, interpretive tools to the table. But in terms of breadth and depth, I think a lot could be gained if the accounts coming out of this crisis could be seen in closer connection with those emanating from the people who have undertaken and are undertaking the groundwork. Thank you.
Thank you so much, Anna. This was a really wonderful kind of way to segue into discussions about this crisis of care that you speak of and to connect to the fellow roundtable panelists. So we have a few minutes before we break into the larger Q&A with the audience. And I just want to remind people in the audience before that the link to the Etherpad is posted in the chat. And we can post it again later to help facilitate the collection of questions. So, but please feel free to already list your questions or to put your name on the queue for verbally asking the question. Maybe I'd like to turn it over to Harry and Edna to see if you have any quick responses to what Anna just mentioned, and she referred to your respective videos and talks.
Sure, right, okay. I have a question, each question for Edna and Anna. First, Anna's is actually, I don't think this is directly related to your video, but actually because I'm also writing the history of palliative care in Hong Kong. And then I'm curious about what do you think about that, for example, like the palliative care movement or hospice previously, that it's been there for more than 3 decades. Did it really prepare us for this pandemic? Because we see a lot of very horrible death scenes, right, globally, right? And then also, did this? In your opinion, how did this pandemic inform or have an impact on the way that palliative care is going to be studied, or how well, instead how this pandemic have an influence on the concept of palliative care or hospice, right? This is my question. And for Edna, that well, you're talking about that you're doing some interviews, and I'm also very curious, and I think this is very important that we should really quickly and to accumulate a lot of primary sources, and then so that we can understand the life stories behind those statistical figures. And then in your mind, what should be in the archive that we are going to build right now? Yeah, these are my questions.
So thank you so much for summating all of these wonderful ideas and points, and Anna for talking about and referring specifically to our Harry and Mai's videos and the importance of literature and interdisciplinary work. I think that for me, one thing that I am trying to navigate through is both the presentist aspect of the pandemic, insofar that I have a bit of survivor skills, especially having had immediate families who tested positive. And several days ago, another friend tested positive. And so I'm oscillating between the real world impact with like doing work and writing and doing research. And what I would say is so important in terms of what should be in the archive or a archive is that I don't see an archive as a static place per se, as a building or as something that is inaccessible to the public. But in many ways, I see it as something that can hopefully be audio. It can be something that people are processing consistently, visual, publicly available. And speaking with an artist earlier today that I interviewed, through Zoom, one of the things that she was making the case for is that museums shouldn't be something that is that people pay for. It shouldn't be something that's just located on one site, but it should be something that travels between spaces that everyone has access to. And I would say that the archive should also have that, and that everyone, to the best of their ability, should be able to have the tools to do archival collections, whether it's through their personal family documentations, etc. And so for me right now, the collection of what I think should be included, music. So for example, Spotify now has like people creating COVID related songs from rap to trap to reggaeton, like it's all being compiled. So people are responding to it in that method. There's also like things like social media, TikTok, and these things might be considered like quote unquote low arts and ways of articulating stuff, but it represents often the majority of regular people who are documenting this stuff. And of course, I think it's important to look to journals, people's diaries, how people reflect online or offline, and hopefully at some point there could be a mega database that is able to interpret all of this information in the many languages that is being represented. And one of the things that I've been lucky to have access to is still because of the internet, people, friends, even if I can't see them physically, the ones who are in South Africa, I can text them quite easily and they respond very quickly, or people who are based in Kenya or in the States. It's been quite easy to maintain that contact and to interview people, because a lot of people have time on their hands, but I guess we're still processing everything. And I will, in the next few months or so, I'll be able to better write about some of the things that I've been collecting. Yeah.
Okay. Thank you so much. I'm just gonna answer to Harry's questions first, going back to these. This is really interesting. I didn't know your work on the history of palliative care in Hong Kong, and I think we have to talk about this at some point. I'm really excited to find out about this, because in my work on the history of palliative care in France, what I've been sort of concerned about is that there is very often this tendency to assume a global history of palliative care. And some of the material that I have found in France have been really interesting in terms of showing how different aspects of the values connected to palliative care weren't able to fit into French society. But I think one thing that sort of stands out and that can be said, globally, is that it's as a medical subspecialty, it's been notoriously underfunded everywhere. And I think this, unfortunately, this sort of economic argument will sort of defines how palliative care has or hasn't been able to prepare us for the pandemic, and what will happen in the future. I think very much depends on sort of whether this will be made a funding priority, and this has also been very much on the forefront in the French discussion. And then perhaps digging a bit deeper, I think the question is also have we, in a way, was palliative care becoming a medical subspecialty? Have we thereby turned over completely dying to medicine? This is sort of I think the other side of the discussion. And then if we did, then for example, this is very much the case in the French healthcare system, but also in the US, that we've created palliative care silos in hospitals. So why are we not spending more time in the medical curriculum to teach students about death and dying? If you look at the numbers they spent learning about that aspect of care, these are, very, very low compared to other skills they're picking up. So I think this really emphasis on silos together with the medicalization of dying, these are sort of two important points to keep in mind when thinking whether palliative care has prepared us for the pandemic. And then I think the answer is still out. How the pandemic will reshape palliative care, but for me, this sort of failure to include palliative care as an essential health service by the WHO spoke a lot to the role palliative care plays, and I think I would hope that this would change in the future, but I think we will see. We will see what happens. This morning there was a report of sort of the head of the emergency service of one of the biggest hospitals in Paris quitting his job because he felt there was a lot of talk of providing more money to the healthcare service, and yet nothing really happened in that direction. So I can't really speak to the future of palliative care, but I'm extremely interested to see what sort of an impact that will have on the development of this part of medicine.
Thanks so much. Are there any other final points that maybe the panelists would like to ask of one another? Edna, do you have any particular questions? Or we can move on to taking some questions from the audience. We have a little list forming already.
Can I ask one question to both panelists, because it came up with both, and it's something that I was really interested in, and that's the connection that Edna mentioned between children and mental health. And I was wondering about Harry's work in particular, how he felt that the sort of how questions of mental health have entered into public discourse, and also the sort of communication about the pandemic by the WHO since the start, whether there's sort of a marked change in communicating about mental health issues associated with that. And the question I had for Edna, I saw that I think it was the German Ethics Committee who at some point published a statement on children and mental health during the pandemic, and calling for sort of the right of presence, or right to presence, that children shouldn't be, that sort of the lockdown measures would impact children's mental health. And I was wondering whether you've been following the German case, in particular discussions around children's rights and mental health.
So who would like to take the question, Harry or Edna first?
Sure, I can speak first.
Okay.
Right. Okay. Thank you, Anna, for your wonderful question. And because my book actually started in 1970s, right? So I really haven't touched upon more recent history of WHO. But actually, it's quite interesting that in my book that is going to be out next year, I talked about a critical moment for the WHO to globalize mental health issues is through the work of psychiatric epidemiology, right? By creating a common language that is the glossary of mental disorders, which is ICD, International Classification of Diseases. So nowadays, we know that mental health can take shape in the form of that we understand that certain problems is what disease or what disorder we have a name for these different conditions. But now, gradually, in 1990s, what's happening on the ground is that a lot of suffering in, for example, like in war zones, in extremely poor areas, in, for example, like, or not those areas that are still not in peacetime. This kind of approach, statistical approach and common language approach, cannot really account for people's the content of suffering of certain people. And I believe this is still the same nowadays we're facing during the time of COVID-19. For example, like those people who suffer from loneliness, isolation during lockdown, it's very different from people in Hong Kong who are really, who is quite resentful of the government, who has been, they're dealing with the political turmoil for the past 1 year, and leading to a very vast distrust among the public. So people don't trust any kind of public health measure that is taken by the government right now. So the content, that kind of resentment is very, very, very different, right? So yeah, so interesting question. So I think now at the global or transnational level, people really want to have to pay attention to the content of what people are concerned, what they are really suffering from. Yeah.
And how about, thanks,
sure.
Harry. How about the situation with children's rights in Europe, Edna?
Children's rights?
This is the Anna's question for Edna about children.
Right, yeah.
Yeah.
Sorry, I was muted. I think one of the things that I would say is that there was the, I guess, UNICEF report that I had read, specifically that urges governments to protect the child well-being of children in the light of COVID-19 educational fallouts, especially with reduced hours in kindergartens, etc., and them noting that it could be a burden on the mental as well as physical well-being of some children. I think one of the things to note is that I would agree that children should have the right and the freedom to move about, to see their friends, etc. However, it shouldn't be the burden of these schools to have that without public health safety measures. So unfortunately, there's a huge difference between the public health safety measures in the US in terms of when schools are open, which then leads to a kind of proliferation of transmission versus like the South Korean model, where provisions are put into place with plastic or with dividers and masks, etc. And so I think one of the things to kind of bear in mind is allowing and giving space to children to have the conversation to understand what's going on, so that they have more agency as this new normal, as someone said earlier, is proliferating, while also giving space and funding for better provisions for healthcare, for so physical distancing measures, etc. Because what the U.S. data shows, especially if there isn't a kind of federal and or governmental approach to adequate public health measures, is that the virus spreads, and it spreads so in a way that it actually costs the lives of children, and mostly Black and brown children. And so I think that when one is looking at lockdown measures and what relation it might have to mental health issues, it should also be done in a comprehensive approach to minimize to the best of one's ability the physical health of people and what that looks like. Germany has done far better than the US, as the data shows, in terms of implementing those public health measures. And the lockdown has it's not a full one, in the sense that the kids do have the option to go in kindergarten, etc. And I live near Akita, where they are running around screaming all day. So it's not as extreme, I think, as perhaps the far right media would like to assume, but it actually has happened in gradual stages ways that look to the science and the data, as well as how to have those public health measures. So that's what I would say to that.
That's a perfect way to wrap up some of the things that we've discussed today. So I'd like you to please join me in thanking them and thanking our speakers, Harry and Anna and Elsner. And please thank yourselves for showing up and sharing your time and being generous with yourself and with all of us. So thank you.